Now, before we get to Dr. Reifler, I would like to give a brief bio regarding him. He is a graduate of NYIT College of Osteopathic Medicine and completed his residency in family medicine at Nassau University Medical Center in East Meadow. He is board certified through the American Osteopathic Board of Family Physicians. As a family physician, Dr. Reifler specializes in the care of all ages and genders with regard to disease and preventative medicine. He is passionate about public outreach and has participated in numerous events, including career fairs, medical clubs, community talks, and has spoken at the Donald and Barbara Zucker School of Medicine at Hofstra, Northwell, to groups of rising juniors, rising seniors, and rising college freshmen with backgrounds that are underrepresented in medicine. So now, without further ado, I'd like to introduce everybody to Dr. Reifler.
Hello, everybody. Thank you very much for having me today. Yeah, that's a great, that's I guess that's my whole bio, more or less. I also am from Queens, born and raised in Queens. My wife, born and raised in Queens, and works in Jamaica. So we're still very connected to the area. So, I'm glad to hear about your guys' programs and everything like that. So I'm here to talk to you today about sleep medicine. Sleep medicine is a topic that's been very on the minds of people, especially since the pandemic, but it's always an important topic. So I'm going to just show my PowerPoint slides here. Second here. Okay, if everybody can see that. Basically, I'll get started, and if anybody has any questions, I'll definitely be happy to take them at the end. Here we go. So once again, this is me. I work in Belmore right now. I have an office with Northwell Health. We have a lot of specialties here. We have we used to have sleep medicine come here, but not anymore. But we do have pulmonology here. We have rheumatology here. We have internal medicine, and basically anything you could think of. We have resources in the area. So this is our number, and this is our location. So what I'm going to be talking about today is broken down into a couple of little chapters here. We're going to be talking about sleep in general. We're going to be talking about, so we're going to be talking about insomnia, jet lag, which are some, problems that people have with sleeping. We'll talk about sleep apnea, which is really common among people, usually snoring. People will know as part of sleep apnea. We'll talk a little bit about things that happen while you're sleeping, nightmares, sleepwalking, sleep talking. We'll talk about things that interrupt your sleep, like restless leg syndrome, teeth grinding. And then ultimately, we're going to be covering sleep hygiene throughout the entire lecture. And that's how to get your best sleep possible, recommendations on sleeping correctly as it is. Okay. So insomnia and jet lag is first topic. 25% of people are experiencing an episode of insomnia each year, and 75% of those people will go on to develop chronic insomnia or poor sleep habits. Insomnia doesn't have to be something that's like a lifelong or weekly or daily. It could be something that you have an episode of insomnia just means you can't sleep. It means that maybe there's a problem with your environment for sleeping. Maybe you have stress in your life. Whatever it is, there's always it's a diagnosis of insomnia, and there's multiple ways of examining and treating on that. Some of the symptoms, like I said, difficulty falling asleep, or sometimes it's difficulty staying asleep. Sometimes it's early wakefulness. You can have variable sleep where sometimes you're sleeping okay and other times you're not. Usually what ends up happening is you end up with daytime fatigue, forgetfulness, irritability, poor concentration. Anxiety and depression can be worsened by insomnia. And you may have increased errors or accidents related to driving or other intensive activities. And sometimes also people will have ongoing worry about sleep, like wondering if they're going to be able to fall asleep. And it just makes it even more of a vicious cycle. There are short-term causes and long-term causes of insomnia, and it's important to really kind of figure out what's going on, because a short-term cause may not need any treatment. It may take some time, or it may only require a short amount of treatment, whereas a long-term changes to your sleeping habits may require other different kinds of treatment. In the short term, things like poor temperature in the room, if it's very hot or very cold, if it's very bright or very loud, that could affect your sleep and cause insomnia temporarily until that situation is remedied. There's also is the stress of the loss of a loved one, divorce, or job loss. It could weigh heavy on your mind and interfere with your sleep, racing mind, that kind of thing. Illness, surgery, or pain that all can interfere with your sleep. Fevers, issues like that can interfere. Certain medications and certain alcohol or other drugs can affect your sleeping. Jet lag, traveling from west to east primarily, can affect your sleep, and so can shift work, where if you don't have a standard schedule of a 9 to 5, some people are working overnights, that can absolutely affect your sleep. Some of the more long-term problems, or things that are going to require more of a in-depth workup, is going to be mental health problems. So any kind of mental health diagnosis can be associated with insomnia. Medical illnesses, neurological disorders, that sort of covers the gamut of that. So if you're having jet lag, if you're going to travel for work, and you're especially traveling from west to east, which makes the symptoms a little bit worse, there's some recommendations. Choosing daytime flights where you leave in the morning and you still show up in the morning is the best, minimizing sleep loss. If you have to travel overnight, you should sleep during the flight, and you should avoid things like large meals, caffeine, and alcohol during the time where you're normally supposed to be sleeping. Increase hydration. There are all these other little things that you could do. You can take melatonin sometimes. It says melatonin can help you with your sleeping on a new schedule. If you take it at the night where you're going to be arriving. And general recommendations is to avoid doing any kind of driving or any kind of issues with any kind of issues that require you to be focused while you're still in that jet lag mode. Sorry about that. I'm still here at work. People are going to call me. All right. So as far as treatments go, there are a couple of different things. Anti-anxiety medications are a very useful thing. A lot of times people will take a Xanax or something in the short term, but when it comes to long-term, months or weeks of symptoms, it doesn't really help to be on that kind of medication for very long term. People will use Ambien if there are no other causes identified for issues with sleeping, and that's usually pretty effective. The good thing about the anti-anxiety and the Ambien is people will tend to have a restful sleep. Sometimes people are using antidepressants or antihistamines to help them sleep. Antihistamines is not generally recommended, so that would be things like ZQuil or Benadryl that people will take. And the reason we don't recommend it so much is because the sleep is not as restful. And if you're, let's say, an older gentleman, sometimes it can cause urinary retention. So, with the enlarged prostates and things that men experience as they get older, taking an antihistamine may make you wake up in the middle of the night, have to urinate, or may cause some sort of retention that can become problematic. Melatonin is also used as a supplement to help. Behaviorally speaking, we're going to talk about sleep hygiene. So people who are having poor sleep, there are certain ways of going to sleep that will help you throughout your sleep cycle. There's, obviously relaxation, things like biofeedback or sleep restriction can help. So sleep restriction would be something like you don't take a nap and you force yourself to fall asleep at the right time of day, or you push back your sleep schedule in such a way that you eventually get back on cycle. There's always going to be things also like phototherapy, chronotherapy. These are all just like little things you could do. Phototherapy being like exposure to bright lights while you're supposed to be awake versus no lights while you're asleep. These are all things that can help. Okay, so moving on to sleep apnea. So most people recognize sleep apnea as snoring or stopping breathing in the middle of the night, waking up choking, waking up, partner might wake you up because they said that you either stopped breathing or that you were snoring so loud. What really is happening most of the time in sleep apnea, at least in this kind of sleep apnea, which we call obstructive sleep apnea, is that you'll see that the tongue and the soft palate of the mouth will fall to the back, and that excessive tissue will cause the blocked airway. And it usually happens when the neck size is increased, which is usually represented by if you're overweight, but there are other possible causes as well. So sleep apnea, some of the symptoms you would notice, like I described, it's the restless sleep, the choking, the gasping, the feeling of not being able to breathe. If you wake up with a dry mouth, you may be breathing through the mouth. If you wake up to urinate, occasionally it's because you're waking up from the snoring and not because you have to urinate, but you're actually waking up. Because you're up, you go to urinate. So it's important to figure out what the correct, is it the chicken or the egg kind of thing? Are you waking up to urinate, or are you waking up and then urinating? People who have sleep apnea, one of the worst side effects of sleep apnea is the blood pressure being uncontrolled. And often we'll see patients on 3 or 4 blood pressure medications, and it's just not working. And the reason it's not working is because the sleep apnea has not been addressed. And when you use something like a CPAP machine, that's sort of the treatment for sleep apnea, or depending on the particular case, you can resolve that blood pressure issues. Now, some of the things to know about sleep apnea is that we have what's called modifiable risks and non-modifiable risks. So non-modifiable risks are, as you get older, you're more likely to have sleep apnea. We can't control that. If you're a male, you're more likely to have sleep apnea. And if you have any abnormality of the airway, that can't be modified without surgery. So, and the modifiable things are obesity, which if you lose weight, it usually helps. Sedation from medication or alcohol. If you avoid those things, then that can help as well. Some of the things that you should know about sleep apnea, other than the increase in the blood pressure, is that you have an increased risk of heart attack, diabetes, liver disease, surgical issues. When you have surgery, it's more difficult to wake up. And also, all-cause mortality is increased by 2-fold. So that means for any possibility of, if a person's risk of death is some percentage, a person who has sleep apnea's risk is twice as much. So some of the treatments, as I discussed, is CPAP machine. That's a continuous positive airway pressure machine. So as you're breathing out, there's resistance from the machine, and it opens up the lungs, and it helps with restful sleep. It helps with the blood pressure. It's a very good thing that people like, and people are using these giant machines and things, but recently they have changed, and now there are a lot more options, especially nasal CPAP and quieter machines. We also have dental devices, and depending on the type of sleep apnea you have, and surgical treatment depending on the type of sleep apnea you have. Other than that, lifestyle adjustments, of course, weight loss we talked about, avoiding alcohol and other sedatives, and adjusting your sleep position. You're less likely to snore if you're sleeping on your side. I added this slide recently because a lot of people have been asking me about it in the question and answer portion. And there is this new device that can be implanted in the body for people who have sleep apnea. And it's called Inspire. And I don't know anything about the company or anything like that. I have no disclosures about the company. It's just the only one that I'm aware of. And basically, it's a electrical signal that has a little battery. And if you can see, there's this wiring that goes to the jaw muscles. And basically, when it detects that you're snoring, or it detects something about your oxygen levels, it does a small electrical signal to that area of the mouth, forcing the tongue and soft palate forward. And there are doctors who can evaluate you for this. It's definitely sleep medicine doctor. There are sleep medicine doctors at Northwell who work with this particular device. And basically a couple of qualifications on the bottom being moderate to severe sleep apnea, which is defined by a certain number of awakenings at night or a certain number of apneic events at night where you're not breathing. If you're struggling with the CPAP machine or it's not working for you, you may use that not for obese people or very obese people, that, as it were. And you have to examine the airway and make sure everything is, would work with this particular device. Okay. The next thing I'm going to talk about is a little bit is nightmares, sleepwalking, and sleep talking. These things are more common than you think. Obviously, children are mostly well known to have nightmares. 50% of children have nightmares. 20% of children have frequent nightmares. 85% of adults have had a nightmare at least once a year. And 2 to 6% of those adults are having weekly nightmares. So it's not a huge portion of the population, but it exists, and there are a lot of different reasons for this. Some of the causes, of course, trauma and stress. People have nightmares about things that weigh heavy on their mind. Depression and other psychiatric disorders can cause nightmares. Certain medications are known to cause nightmares. For instance, people who want to quit smoking, sometimes they use a medicine like Chantix. That medicine is particularly well known to cause what they call it vivid dreaming, but it's basically nightmares, as well as people who travel to other countries, like countries in Africa where they're getting malaria prophylaxis, quinolones, things like that. Those things will also increase the risk of nightmares. So like quinine and other certain medications. Stopping certain medications could cause nightmares, and then there are other unknown causes of nightmares, most likely psychiatric. Some of the treatments for nightmares is watch and wait, meaning you don't do anything. You just sort of just wait it out. Sleep hygiene, which, like I said, we'll talk about a little later, about sleeping at the same time every night, certain things like that. Those can help with nightmares because, it just helps with sleep in general. Stopping certain medications, obviously on the advice of your doctor. Psychiatric disorders that need to be treated, nightmare-focused psychotherapy, and there's a medication, prazosin, which is a blood pressure medication that for some reason also helps with nightmares. So I have seen people taking it for nightmares. Apparently it works. So I have never had to prescribe it, but I don't see that many people who complain of nightmares being their primary concern, but it exists. So maybe sleep doctors do see a little bit more of that. Sleepwalking is also another thing that happens to people at night. It could be eating, running, talking. It all falls into the same kind of category. People don't remember that they're doing it. They get out of bed. They're basically sleeping. Sleepwalker usually goes back to bed without any problem. Some medications make it worse, like Ambien is well known to cause complex behaviors at night without people realizing it, making sandwiches, trying to leave the house, the locks, the car door, the cars. It's people driving on Ambien. It's pretty interesting, but it happens. It can be worsened by a lack of sleep. So if you don't sleep, you might sleepwalk. Fevers are known to cause sleepwalking in children, especially. Other medications, alcohol. It's a very dangerous situation if you're not aware of your surroundings and you're trying to move around. I would say that it's okay to wake up walker or to redirect them to the bed. Those things are not as dangerous as if they were walking around and hurting themselves. So I always recommend sleepwalking, just lightly let the person know something is going on and you can kind of redirect them. Okay. Restless leg syndrome and teeth grinding. So restless leg syndrome is becoming more common of a diagnosis. I seem to recall maybe 10 years ago, they started advertising about it on TV. Maybe they're just discovering it a little bit more. But basically, restless leg syndrome comes down to a couple of symptoms. We have feeling in the legs that usually happens when you lay down. So those called crawling, itching, throbbing, pulling feelings that it all happens. It's not just like when you're walking around, it's when you're laying down to go to bed. Moving helps, and sometimes twitching legs at night is one of the symptoms as well. If it wakes you up, it's not good, obviously. If you can sleep with it, it could be normal movements. There are normal movements of jerking that happens when you wake up or fall asleep. So you have to rule out those things before thinking it's restless leg syndrome. Common triggers seem to be a theme here: smoking, alcohol, caffeine, drug use, that kind of stuff. Extreme exercise can do it too. If your muscles have become very cramped during the day, that could become a problem. Certain foods and certain medications can worsen it. So Benadryl and melatonin, which people are using, like we talked about, to help them sleep, it can make RLS symptoms worse. Antihistamines and antipsychotics and antidepressants. Okay, so antipsychotics and antidepressants, probably because of the effect that they have, similar to the antihistamines. Some of them are work in a similar way, and I think that's why they're all related in some way. Treatment, hygiene, watch and wait. Some people have an iron supplementation issue, like if you have low iron. If you have a chronic condition, it could make it worse. So usually when somebody has a problem like this, we'll just do routine blood work. We'll do a full exam. We'll make sure that everything is okay before we start trying to treat it with medication. Teeth grinding falls in a similar category of restless leg syndrome. People may not realize they're having it. They will only have the symptoms, which would be like a headache on waking up, facial pain all the time, sensitivity, your teeth grinding down, like wear on the teeth that a dentist might say, hey, your teeth are looking worn down. Tinnitus, hearing the ringing in the ears. A partner might tell you that you're having very loud grinding teeth noise, and sound is very distinctive. It's sounds like a water bottle being crushed up. It can be very loud. Indentations on the tongue if you're biting your tongue, and a lockjaw. Some of the risk factors are smoking, sleep apnea, alcohol, caffeine, anxiety, stress. It can be temporary, it can be long-term. Medications have some limited use, but if it's if it's a psychiatric issue, obviously treat that. If it's you can give Botox shots if there's very strong muscle component to it. You can give Botox shots, and it'll make the muscle a little bit looser. And then mouth guards help with the wearing of the teeth, and certain medications can be discontinued depending on, what your doctor says. They may be causing some symptoms. So ultimately, the big crux of everything, sleep is sleep hygiene. We do want to talk about how to get the best sleep possible. And invariably, when I talk about sleep hygiene with people, I recommend certain things, and people will say, well, I do X, Y, and Z, but I sleep just fine. Well, the information is for when people are not sleeping just fine. It's when you're having trouble sleeping, not necessarily if you're able to sleep very well and that, I need you to do these things. So I'll just go through a couple of these things, and we'll discuss them. Let me just close this here. Okay, so exercise. So exercising is good. It helps you sleep. Any exercise is good, but we don't want to do it too close to bedtime. The recommendation is like 1.5 hours before bed. You don't want to be doing exercise because you're increasing your risk of like restless leg or other kinds of problems related to that. We recommend not taking naps that much. Naps can interfere with the sleep cycle. So we definitely just want to go to bed the same time every night, wake up at the same time every day. If you're having trouble sleeping, I recommend doing that every day of the week, especially, on weekends, vacations. You just go to bed the same time every night, wake up the same time every day. And when you wake up, we don't want to hit the snooze button. We just want to get out of bed because it sets, it's a cycle. You basically want to be, when you're in bed, you're sleeping, and when you're waking up, you're out of bed. Before bed, you don't want to take alcohol, caffeine, chocolate, nicotine. Try not to do those things. Limiting liquids in the evening before going to bed, using the bathroom before going to bed, prevent you from having to wake up in the middle of the night. Maybe not to drink an hour before bedtime. Turning the TV off before bedtime. I usually recommend not to watch TV in bed because the bedroom is really should be your sanctuary for sleeping. Anything that you're doing that's not sleeping, like work or reading or watching TV, you should do in another room because especially now with COVID, people working from home, people are turning their bedrooms into their offices, and you have no separation of sleep and work. And it can be, it'll just rack your brain all day. So definitely recommend separating your environments into recreational environments, sleeping environments, and working environments. If you can't fall asleep, you don't have to lay in bed because it's just going to put you in a bad mood towards the bedroom and be like, every time I lay in bed, I can't sleep. So you just kind of want to get out of the bed, move around, do something else, and then go back to bed when you think you're tired. Like I said, the other thing, going to bed the same time every day, having a snack may help, like a light snack, not like a ton of food or anything like that. Don't watch any clocks, turn off all the lights, flip everything down, cell phones, flip it over. You just don't want to see things bright lighting up in your room. And, laying down in the bed in the comfortable position, essentially. Like I said about getting out of bed, if you haven't fallen asleep, get out of bed, do something else, and then go back to bed when you feel tired. And it's recommended that it may not work the first night, but it's recommended you continue that cycle, that sequence, until you reach a pattern that is promoting sleep. Okay, so basically that covers sort of the basics, the outlines of everything that I wanted to talk about. I do, in the office, we do all the full service internal medicine stuff where, physical exams, controlling diabetes, blood pressure, all that stuff. So it's full service, make sure that, everything is healthy before we think about treating sleep as if it were something in and of itself. We saw how it can connect with all these other medical issues. So essentially, it's essentially my lecture, and I just put up my information again. And if anybody has any questions or anything that they wanted to ask about, I'm happy to take questions. Okay.
Yeah. Excuse me, doctor. Could you kind of review the nightly nightmares? I had to step away because the post office was here. Could you just review the nightmares? I get them on a nightly basis. Then, for years, I didn't call them nightmares because they were, it's not monsters and it's the normal everyday stuff. But things are kind of like, I'm rushing or anyway, they're nightmares. Mm-hmm. Could you review what causes them or what I could do to reverse them?
Sure.
And I've had them for years.
Okay, so there are a couple of things. It's impossible to diagnose without knowing the whole history and knowing the medications and the blood work and everything like that too. But often there are causes for nightmares that could be medication related. That is a possibility. It could be chronic conditions related. So I know somebody who had extremely poor sleep, couldn't get any rest because they had anemia and it wasn't being treated. So you have to always make sure you're ruling out any organic causes or medication causes. And then these psychiatric causes, anxiety and depression and things like that, which could always be addressed. There are medications for those things. Definitely, there are a lot of different possibilities of what could cause nightmares in a person, especially if they're daily. And there are medications that can treat it as well. If everything looks normal on the blood, everything is okay with the medications list, and it only comes down to nightmares, there's the possibility of certain medications that are prescribed specifically for nightmares, like the prazosin that I discussed. And that's a blood pressure medication, actually, but it has dual effect on nightmares. So ultimately, the treating of nightmares can be multifaceted, can come from, it depends on what the cause is, but that has to be figured out first.
All right. Thank you.
Sure.
Okay. Thank you, Flo. We have two questions in the chat from Regina. Let me highlight Regina for you, doctor. There you go. All right. Okay, so question one from Regina. Are bed types, pillow types, and sleep positions ever a factor in a good night's sleep?
Everybody has their own patterns of sleeping, so there could be some component of it, because let's say that you're in a hotel and it's a different pillow than you're used to, and you can't fall asleep. That would be a temporary type insomnia that we were discussing based on the environment. I do think that everybody's a little bit different. Some people want to be sleeping on the side, some want to sleep on the stomach, and some want to sleep on the back. And there's no medical reason why you couldn't do any of those things. Sometimes in pregnancy, they don't recommend you sleep on your back or your stomach because of the way that it can affect, the blood flow or the discomfort of it. So most people, I think, will find by a certain age their natural way of sleeping. And I do recommend people try, multiple different kinds of pillows and different, things to see what would benefit them the most. But other than that, there isn't a requirement for any special type of pillow. And often, there are expensive pillows and cheap pillows, and you can get good sleep on either one.
Okay, and the second question from Regina is there any truth to the sleep theory that it is the best to be in bed by 10:30 to get the best night's sleep based upon the number of sleep cycles one goes through in an evening?
So people do have the sleep cycles is I might put that in my lecture for next time. There's REM sleep comes after a certain amount of time, and I believe the sleep cycles run on about a 90-minute cycle where you have your first 30 minutes of NREM sleep, then you have your REM sleep, and then it just cycles like that, the deep sleep. So there is a benefit to waking up outside of a REM cycle for the most rest, that the restfulness of it. And if you can time yourself to fall asleep, which a lot of people really can't. You don't really know when you're going to fall asleep, but when you do fall asleep, you start your cycling. They have lots of devices now, like watches and things that can tell when you're in REM sleep and wake you up in the correct interval, or depend when you've fallen asleep and wake you up at the correct interval. That can help. That can help with feeling well rested, or waking up not feeling groggy. But ultimately, everybody has their own amount of sleep that they need, and entering REM sleep is the restorative type of sleep, which is why I recommend avoiding certain medications that promote sleep but do not promote REM sleep. So, that would be Benadryl and things. You get sleep lag. You wake up, you didn't have any dreams or something, and then you're very tired.
Thank you. Okay, then we have a question from Linda. She's wondering if you could address, let me find it, if you could address sleep issues related to aging.
As people get older, sleeping does become more complicated. The sleep requirements of an older person become less rigid. Usually they say that children and teenagers need that 8 hours of sleep, whereas older people sometimes function on 4 to 6 hours of sleep. Ultimately, ultimately the amount of sleep you get is depending on, well, the amount you need is dependent on how you feel. If you wake up and sleep with 4 hours of sleep, well rested, able to work, able to drive, you're not falling asleep during the daytime, your sleep is restful, you can keep doing that. There's no reason that somebody has to sleep a certain amount of hours, but on average, people are sleeping between 6 and 8 hours, are feeling more well rested. But yeah, there's no reason that you as you get older, and if you find that you're able to sleep less often and feel just as good, there's no issue with that. If you're having a short amount of sleep because you're getting older and more difficult for you to fall asleep, then that can be addressed.
Okay, thank you.
Okay. Then we have a question from Michelle Finnegan. She would like to know, would your primary physician be the source to take the blood test when concerned about medication, I guess, during night routines? Is that correct,
So,
Michelle?
right. So I think that the primary care doctor is an excellent resource. Like, that's what I do. If somebody is coming in for the first time, or it's somebody's annual physical, you definitely want to get the full panel of blood work. That's usually the CBC for anemias, the liver kidney functions. You want to check the lipid panels for cholesterol. We want to check on thyroid levels. These are the baseline basics that you want to be checking in the beginning when you're starting your workup for any sort of illness. And I think that it's a good idea to go to your primary doctor even before going to a specialist, because they have a good insight usually on where you need to go and what needs to be done. So if it comes down to, and like I said, like in the past, if you have an anemia, or if you have a psychiatric issue that's interfering with sleep, the doctor, the primary doctor, is most likely going to be the one who treats that or starts the treatment on that and sends you down the correct path. Because somebody who is having difficulty sleeping shows up to sleep medicine, these people are very specialized doctors. Most of the time, they're going to get a sleep study and they're going to be looking to put you on CPAP machine. If they don't think that you need either of those things, they may send you out to another specialist to do the workup. So I definitely recommend starting there.
Thank you.
Okay, and then one last one in the chat, and then we'll open it up to see if anybody else has anything else. From Cecilia, she says that sometimes at night she finds herself falling asleep and then all of a sudden is jerked wide awake and can't go back to sleep. It happens often. Any reason why that might be happening?
Yeah, there are a lot of different reasons that could be happening. Sleep apnea is a big reason that could be happening. If you're choking or something, or you stop breathing at night, your body wakes you up, and you may have that kind of like movement. You may like jolt awake and then wonder what happened. You may not have like memory of the what exactly happened. Just know that you've been jolted awake. There are specialized type sleep disorders where they call them like REM disorders, where people normally when they're in REM sleep, they're moving around in their dreams, but only their eyeballs go back and forth because the body naturally like sort of paralyzes you. You don't move when you're sleeping during otherwise you'd be punching and kicking and all sort of things like that. But there are occasions where a person who is in REM sleep is not laying still, and they actually do move, and that movement can, sometimes it can hurt a partner, sometimes it can wake you up. If you're finding that you're asleep and then you experience these things, yeah, it's kind of abnormal and it should be looked into by a sleep specialist. But if you're, let's say, falling asleep and jerking, that could be restless leg, or that could even be a normal thing. It's called hypnagogic jerking. So if you're falling asleep and your leg kicks or something like that and it wakes you up, that could be normal. But if it's waking you up, it may still want to be treated in some way, because you don't want to be, every time you fall asleep, wake up. So it's something that can be figured out. But I always say start with the basics and go from there. If it's something about like that you're not able to sleep through the whole night, there may be something that could help with that.
Thank you.
Can I ask a quick question?
Sure.
Going back to restless leg syndrome, my mother suffers from that. Would it be a possibility to wear compression socks or any of that sorts to help with that, to help relieve those issues slightly?
It depends on the cause. If the restless leg syndrome is directly related to a blood flow issue or a diabetic issue where you have tingling and burning in the feet and legs all the time, treating those symptoms will help. If compression stockings are something that are helping, it might be okay. But I don't usually recommend people sleep in compression stockings. Legs can be raised at night if they're swelling. I would say that it would be best to find out what exactly the cause is of that. So if compression stockings work for specific issues, if it comes down to that it's a leg swelling issue or neuropathy of some kind, we would want to find out where is that coming from versus just treating the symptom, I would say. And if we could treat that issue, then the sleep might come natural. It may not be restless leg at all. But if it's cramping occasionally, that could be dehydration issue, or that could be electrolyte issue. Some people do very well with taking iron supplementation or magnesium supplementation, and that will help with cramping type pains that have to do with restless leg. It's restless leg is kind of a catch-all, I think, but I try to make a distinction between a actual symptom of a medical condition versus a restless leg, which has no other explanation. And when you call it restless leg, it's like you ruled out everything else, and then you start treating that with the restless leg type treatments.
Got it. Thank you.
All right, thank you. Does anybody else have any questions for the doctor? We still have quite some time left, but if there's no further questions, I guess we could.
See, there's a question about exercise. It says, is it recommended that doing more exercise helps with sleep? I don't know why I can sleep during the night. I assume means can't sleep during the night, even though I sleep at the same time. Yeah. So exercise can be beneficial.
Not point, actually, Dr. Matthew. That was to worry that, even though I try to sleep and go to sleep and wake up at the same time, even though my schedule is different every day, but even though I do not know if I'm asleep during the night because I tend to go online sometimes, but I do get good night's sleep, but actually last month I get tired just after a couple hours I get up. I have no idea to make that point.
So it's hard to say 100%. Obviously, if sleeping is a problem, you want to rule out sleep apnea because that's very common that people are snoring and not getting full night's sleep. Exercise does help. Exercise should help with sleeping as long as you're not doing it too close to bedtime. It's just during the day, getting out the energy, that kind of thing is recommended for sure. But it's really kind of the explanation for everybody. Anybody who has a problem with sleeping, we can't diagnose it obviously now, but it can be worked up, and there could be something that could be treated. It just really depends on the circumstance. I see a question about blue light blocking glasses. Blue light is associated with keeping people awake. So there's been a weird recent trend with clocks and lights being bright blue, and it's not good. It's definitely interferes with sleep. Most of the phones now have a red light mode where they'll or night mode where it'll put red light over the blue light. Red light is the wavelength that it doesn't interfere with your night vision. It doesn't keep you awake. So anything that you have regarding blue light, it should be eliminated. The problem I have with blue light blocking glasses is that during the day we are supposed to be exposed to blue light, and that keeps us awake. Some people are thinking that blue light exposure glasses helps with screen time or interfering with hurting your eyes and things like that. And I haven't really seen a whole lot about that, but I do recommend at nighttime avoiding blue light. So if you're in bed or you're on your computer at nighttime and you need to be on the computer, but you're going to go to sleep soon, they have apps. They have built-ins that will put your computer into a they call it a dull mode or something like that. Eliminate the colors, black and white, or grays. Sometimes it'll put a sepia tone over it or some kind of red light over it, so that it just doesn't keep you focused on the screen. It just sort of blocks all that out, helps you fall asleep. They even have over time, like it'll work with the sunrise and sunset, and sometimes they'll have like things like on the phone where it'll get, you lose access to apps over a longer period of time, and it just reminds you it's time to go to sleep. So I would just say that blue light blocking stuff at nighttime when you're trying to go to sleep is definitely a good idea. But I think the glasses maybe is a gimmick or something. I don't know. I think people like it, I guess, but I mean, they sell a lot of it, I'm sure. But I don't think it's 100% necessary if you're doing like normal routine stuff.
All right, thank you, Dr. Reifler. Does anybody else have any questions?
I have another one.
There you go. Okay.
What I'm wondering, not last night, but the night before, I had a good sleep according to my Fitbit. And during the day, all of a sudden, I just got so overwhelmingly tired. And that happens every now and then that I have to lay down. I mean, if I'm home, I can do that. But then I can't fall asleep. So why would that happen? Is that stress or?
Yeah, I mean, it's hard to say 100%. If you're having a good night's sleep, that's good. I mean, it's good to keep track of that stuff. I would say that for a lot of these symptoms, you kind of want to obviously, if you know that you're baseline healthy, we have to assume everything is perfectly normal, everything's healthy, the medications you're taking don't affect your sleep cycle or make you tired. Like that we have to assume. If we assume that, then I would say the best thing to do is keep track of the days where that happens and see if there's something in particular that's causing it to happen more frequently or during those days. It's like keeping a diary of your events, the food you eat, the time you woke up, the time you went to sleep, and just seeing if there's some component there. The alternative being that, let's say that your medications are making you tired, or that your sleep for some other reason is not good. Maybe the Fitbit's not able to detect sleep apnea. It just detects if you're moving around, but people stop breathing in the middle of the night sometimes and then start breathing again. Those are called apneic events, and those are going to be tracked with a sleep study. So ultimately, there could be any number of causes, and it could be worked up. Like somebody would be able to do either a sleep study or make sure everything as far as the medications and blood work is good before making some kind of diagnosis on that.
So I should probably, just out of curiosity, just go for a sleep study, because sometimes I don't always go to sleep at the same time. And as I said earlier, sometimes I'm just starting to fall asleep. I'm so tired and I think I'm going to doze and I wake right up. So maybe I have sleep apnea.
It's hard to say. I mean, it depends how if the sleep apnea test will check for a lot of different things. It'll check the brain waves, it'll check the breathing, it'll check the if there is any snoring or what is happening basically as you fall asleep. A sleep study might be beneficial, or it may come back negative, and then it means that there's just another route to work up, so something else to figure out. And it's always a good idea to rule something out, even if you're about to find out something new or rule something in.
Thank you very much.
Sure.
Thank you. We have time for about 2 more questions, which are inside the chat. For Elaine, she wants to know, what time should your last meal be before you go to bed?
Yeah. It depends. It depends. I would say that you don't want to go to sleep like 100%. Like after you just eat, you want to digest, and it's better for even like weight management and health in general. You don't want to eat right before bed. You want to try to expend some of the energy. But I would say I would probably not have a full meal within the last 2 hours before bedtime, because especially with the drinking fluids and such, that would there's a risk that you'll wake up and have to use the bathroom or having another issue. It depends. Everybody sort of starts to develop a cycle that works for them. You can't always control for it. Like if you have a work schedule that can't be changed or accounted for, and you have to eat when you get home and you have to go to sleep when you get home because the next day you have to wake up or whatever it is, it may not be ideal, but we have to eat, we have to do the things we have to do depending. So I think that in general, it's probably not a bad idea to try and give yourself 2 hours before doing anything other than bedtime routine stuff, but otherwise do what you have to do,
Yeah, I know. I guess it's, different for everyone. I don't have a work schedule. I have my own schedule. And so it depends on who else is eating, who wants to do this, and, how late my movie goes off, those types of things. You just got to make sure you don't eat too much or only eat certain things, or maybe just have something to drink in deference to food. So I just wanted to have a general idea of what, you should have 8 hours between, I guess, what you eat last before you go to bed and then when you wake up.
Yeah. I mean, you definitely, digestion. I mean, I think that I think that most people will eat sometime between, like, I mean, if you eat at 5 o'clock and go to bed at 10, I don't think most people are waiting more than, at most, like 5 hours is probably the furthest that people will eat before bed, before they get hungry again. Because you almost get hungry every, like, 4 hours or so. So if you eat at 5 o'clock and you're up till 11 o'clock, you're probably going to eat again by 9. You're going to be hungry, So you have to kind of schedule it, I guess, like that too.
Thank you.
Sure.
Okay, thank you. And then we have a question from Evelyn, which most of us probably are facing. She says, on most days off, I wake up early and feel tired later on in the day. Is there a way to make myself sleep for a little longer on her days off?
Mm-hmm. Now, the question, I guess, would be, are you waking up earlier than your normal work schedule, or are you preferring to sleep in and you're waking up earlier than you prefer? Because when you feel groggy, it has to do with patterns, essentially. That's why I was saying don't hit the snooze button. It doesn't really help. It makes you tired. I would recommend that, let's say that your work schedule has you up at 7 in the morning, and on the weekends, you're sleeping till 8 o'clock and you feel tired. You wake up, you're like, oh, I wish I had slept at 10 o'clock. I recommend doing the opposite and waking up at 7 o'clock on the weekend, the same time you wake up for work, because your body will be more used to it. Every time you have a sleep, cycle, if you go to bed at, let's say, 10 o'clock at night and you wake up at 7 o'clock every morning, you may actually be more tired on the weekends by sleeping in. So, or, staying up later and then waking up a little bit earlier. Your body's trying to do the same thing all the time. So in one way, like I'm up at 7 o'clock every morning, even on the days I'm off, because like my son wakes me up, but I wish I could sleep longer. I always feel like I would like to sleep longer, but ultimately during the day, I'm not tired because I'm used to this type of schedule. So, go to bed by 10 o'clock, wake up by 7 o'clock, and go about the day.
Okay, thank you.
Sure.
Okay, and then Dr. Reifler, I don't know if you could answer this in the short time that we have left.
Sure.
Can you go into the impacts of bad sleep, medically speaking? Folks seem to give sleep very little thought, and it is being flagged as rest, repair, recovery for the brain, seemingly, especially and possibly having an impact on dementia and Alzheimer's.
Sure. So, I mean, it's a complicated question. But medically speaking, one of my slides you saw, the all-cause mortality is something that I think about, and people who have difficulty sleeping, let's say like sleep apnea, which is one of the more common sleeping issues, these people are more likely to die from any circumstance, meaning, what's they call all-cause mortality, is a more likely chance that you'll die of something than somebody who's sleeping very well. And that has to do with blood pressure issues and stroke and heart attack. And sleeping is an important part of that, preventing those things from happening. As far as its effect on dementia and Alzheimer's, it's a good question. I don't know specifically. Alzheimer's is a very strong genetic component. There is, a buildup of plaques in the brain, and there's a lot of issues there. But a good amount of sleep will help in the elderly and demented, especially because there's what's known as like sundowning. And maybe you guys are familiar with the whole idea of sundowning. I usually recommend to my elderly patients that during the day, you want light, in the room. You want bright lights, windows open, lights are on, things are active. And then at nighttime, windows closed, lights are off. You need to establish for people who have dementia a normal wake and sleep cycle, because they lose that. And what ends up happening is people are up at 2 in the morning, think it's the time to go to the store, and it can be very confusing and throw people off a lot. So when it comes to the people with dementia, a sleep cycle is extremely important, and it's important for us to help take care of people who are like this, because we need to put them in an environment that's helpful for them. So like the lights and changing.
Great, thank you.
Sure.
All right, so we're coming up on the last minute. So at this time, I would like to thank everybody for coming out for this virtual series. We are planning on doing it monthly, so I hope that you're all able to join us again this next month. The topic will be discussed with the event chairs, and we'll be sending out an email following this seminar with a short survey and as well as the PowerPoint presentation and anything else, a recording of this video as well, so you can share with those that you know. Thank you, Dr. Reifler, for taking time out today and visiting us. You know, we greatly appreciate Northwell's partnership in this series, so thank you for that, and we hope that everybody had a great lunch hour with QCP and Dr. Reifler. So with that being said, I would like to thank everybody for coming and have a great day, everyone, and an enjoyable weekend.
Have a great weekend, all.
Thank you, Sean.
Thank you.
Bye-bye.
Excellent information.
Thank you. Yes.